Hi everyone. In second part of this video, I'm going to discuss insulin sensitizers. As a quick recap, in the previous video, I've mentioned to you there are currently 7 classes of OGLDs available in the market to treat diabetes mellitus, and we have covered sulfonylureas and biguanides. In this video, I'm going to focus on discussing insulin sensitizers, which include thiazolidinediones, TZDs, and also biguanides. So metformin is the currently available biguanide in the market. The previous drugs, fenformin, has been discontinued because it caused fatal lactic acidosis. So lactic acidosis is a kind of metabolic acidosis whereby there's a disturbance in the body pH and also electrolyte levels, which can cause serious organ dysfunctions in the body. Insulin sensitizer, how they act is that they actually promote target cell response to the insulin, but they do not secrete any insulin, meaning they don't cause any secretions of insulin from the pancreas. And by so, they actually reduce insulin resistance. Metformin, currently available, the branding that commonly used is actually glucophage. The duration of actions of metformin can last about 18 hours. The extended release preparations, of course, can last longer, which often give as once daily dosing with the evening meal. Metformin acts to reduce hepatic glucose output by inhibiting gluconeogenesis, and it also promotes glucose uptake and utilization in the skeletal muscle and adipose tissues. It also reduces glucose absorption from the gastrointestinal tract. And interestingly, metformin also found to reduce some lipid level in the body, whereby it is actually very suitable to prescribe metformin for patients with type 2 diabetes and also with hyperlipidemia because of the effect on reducing hyperlipidemia. Metformin is the first line drug for treating type 2 diabetes, meaning unless the patient is contraindicated or have any allergy to metformin, metformin should be used when patient is diagnosed with type 2 diabetes, and it is particularly suitable for patients who are obese. Remember in the previous video that we mentioned sulfonylureas is not suitable for patients who are obese because it promotes weight gain. So in this case, metformin can be given for patients who are obese because it does not stimulate appetite, and therefore it actually helps to reduce or it does not increase any weight gain in patients with type 2 diabetes. It is important to note that metformin, when the dose exceeds 1000 milligrams at any one time, it can cause significant GI side effects. Therefore, large doses should be given in divided doses, or the extended release preparation should be used in patients. So the common side effects of metformin include GI disturbances, as we mentioned earlier on, and particularly diarrhea is the most common GI side effects, which affect 30% of the patients and resulted in 4% of the patients which need to discontinue the use of metformin. Lactic acidosis is actually a rare side effects, but it can be serious, which we need to take note. So patients who are with renal or hepatic disease and patients who are with alcoholism, we usually need to take extra cautions where they should be contraindicated. So metformin should not be given in this kind of patients because of the risk of lactic acidosis. The next class of drug is known as thiazolidinediones or TZDs. They are often also called glitazones. This is another group of insulin sensitizer apart from biguanides or metformin. The examples of TZDs include rosiglitazone and also pioglitazones. So the duration of action is also long for both these drugs, which can last up to 24 hours, which is why it's often given like in daily dosing. So it is important to note that the first example of drug, rosiglitazone, has been discontinued in Malaysia as well as many other countries due to the risk of causing heart failure. We will talk about this a bit more in the subsequent slides. So how TZD act is that it activates the peroxisome proliferator activated receptor gamma, whereby it promotes the transcription of insulin responsive genes that control glucose and also lipid metabolism. So that actually increased the insulin sensitivity in the fat tissues or adipose tissue, liver, and also skeletal muscles. The TZDs also increase good for, this is one of the glucose transporters in the cell membrane of muscle and also adipose tissues. And this actually promote the uptake and utilizations of glucose in these tissues. So TZD is often used in combination with other oral glucose-lowering drugs in the treatment of type 2 diabetes. They are extensively bound to albumin. So because of high risk of developing heart failure in patients taking these drugs, and this has actually caused rosiglitazone discontinued from the Malaysian market due to the high incidence of heart failure in patients taking these rosiglitazones. Other common side effects include it causes edema and also high plasma volume, and it also promotes weight gain. Most likely it's due to the fluid retentions in the body, and it has been shown to reduce bone mineral density, which is osteopenia. Pioglitazone also shown to have slightly increased the risk of bladder cancer, and other side effects include headache and also anemia.